The kind of the take-home message from that is you do not have to be an addict, alcoholic, diagnosed to have a problem with drugs. Okay? And that's an important distinction, because people think it's like I have to have all these things to be an addict. No, if you go through the DSM-4, TR, yes you do. But in a practical aspect, no. So, how do we define problematic use? Well, this is verbatim from the DSM-4. I'm not going to go through it. But suffice it to say that you have to have 3 or more of the following occurring at any time in a 12-month period. Okay? The one I want to, and like I said, this is, you all have a DSM-4, I'm sure, so you can look it up. You don't have to read it. The 2 things I want to really talk about that are really important and that people have heard about but not sure what it means is tolerance and withdrawal. Okay? So, can anybody tell me what tolerance is? You've all heard the word, right? Yeah.
Just as an anecdote, I met a former NBA All-Star who told me that he was taking, at the end of his career, up to 260 Percocets a day.
That's tolerance. That's also a major addiction. That's also money. Okay? There's another aspect of addiction, that if you have enough money, you don't look like an addict. Okay? We have a lot of our notions of what addicts look like by looking downtown east side. That's not your typical addict. That's an addict with mental health issues. Lots of mental health issues and societal issues. But if you're rich enough and you can afford the good stuff, it doesn't affect you I mean, it'll affect you, but it's not as noticeable. Okay? So yeah, tolerance is basically taking your body needing more and more of a drug to be able to get the same high that you did before. Okay? Now, there's brain chemicals, and I didn't even go into that's the neurotransmitters. But basically the brain and the body and anything in nature likes balance, and the fancy term for that is homeostasis. Okay? When you introduce a drug into a body, the brain's neurotransmitters, typically dopamine depending on what drug, will shut down because they're getting enough of it from the cocaine or what other drug you're doing. So when those shut down, as long as you continue giving the body cocaine, it'll be okay. But at a certain point, given a week or 2, depending on how much, what the dosage is, it balances out. The person doesn't get the high anymore. Okay? So they're going to need more. And once again, there's that kind of a balancing act until you get to a point where it no longer, you're not going to never get the high again. So do people understand tolerance then? So now that brings us to withdrawal. Up until a certain point, people are taking drugs to get a high, to get euphoria, to get the feeling of the drug, to get what they want out of the drug. It's diminishing returns. Once you get to a certain point, the object is to avoid withdrawal. And withdrawal is what happens to your body. It's a physical reaction to the drug. When you remove that drug and the brain says, whoa, what's going on? I no longer have cocaine, let's say, but I no longer have dopamine. Because the cocaine has plugged those receptors. The body's not producing dopamine because it never needed to. All of a sudden, flush of dopamine or flush of serotonin, and you get weird mood swings. Part of withdrawal. Who's had the flu here? Okay, there you go. Everybody's had the flu. Withdrawal is something like maybe about 100 times worse. Okay? So, depending on what drug you're taking, the withdrawal is typically the opposite of the drug. So people on stimulants, you think they're all stimulated and obviously with the high. Their withdrawal, one of the hallmarks of withdrawal from cocaine and any stimulant is sleeping all the time. Whereas withdrawal from a depressant such as heroin is unable to sleep. Okay? There's a little bit of argument about whether each drug has a specific form, a kind of idiosyncratic withdrawal. The 2 that we know for sure have idiosyncratic withdrawal are alcohol withdrawal and heroin withdrawal. Heroin withdrawal is aches, very achy bones they call it. Your bones ache. Inability to sleep, drug drinks, sweating, chattering, diarrhea, constipation. You name it, it makes a runny nose. And it usually typically lasts for about a week. And the 3rd day is usually the peak, and then it starts kind of with diminishing. Okay? Alcohol withdrawal, if severe enough, can cause DTs, which is delirious tremens, which is almost a psychotic reaction. Okay? Well, let me ask you this. What is the only withdrawal that can kill you? Alcohol. Alcohol is the only withdrawal that will kill you. Every other withdrawal may feel like you're going to die, but you won't. But alcohol withdrawal can actually kill you. So when anybody comes in and says they want to, like in my office, they want to withdraw from alcohol, I usually suggest they either go to a detox center or do it through a doctor and slowly titrate themselves off the drug. Because alcohol can cause seizures. Coming off will cause seizures. Okay? So, I'm guilty of this as anybody else, interchanging the word dependence and addiction. I typically use addiction as the kind of just the catch-all word, but it's different. The DSM-4 does not call addiction, it calls it dependence. Okay? There's no such word as addiction in the DSM-4 TR. Okay? Simply because addiction is psychological. Addiction is a compulsion. It's an urge to use. Dependence is a physical phenomenon. And the hallmark of dependence is tolerance and withdrawal. Okay? Now, you can be dependent on a drug without being addicted. So, you need painkillers for your back. You need it to remove the pain, but you're not addicted to it. Okay? You can be addicted without being physically dependent. Certain drugs don't cause a severe withdrawal. Typical marijuana or magic mushrooms or things like that. Or you can be physically dependent and addicted, which is what we consider the typical, stereotypical addict. So to kind of make that a little clearer, is if we all had back pain, let's say, and we were all on Oxycontin, okay? We took it for 3 weeks. If we all stopped taking it abruptly, we would all more or less go through withdrawal. We'd all have the withdrawal effects. The difference between that and an addict is that for some reason you had a magic wand, you were able to get rid of your back pain, you'd still be using the Oxycontin. Okay? That's the compulsion to continue using because it's providing something over and beyond the pain killing, the analgesic effect. Does that make sense? Good. So, addictions, the 3 C's. So this is a really good kind of mnemonic of remembering, that's not really mnemonic, but just remembering what's important about addiction, what it typically means. There's control. You lose control. Repeated attempts at trying to control it, and you think you do, but you don't, and you go back to it. You might be able to stay a day or 2, but you typically go back to it. There's a compulsion. A person experiences a sense that they must use, and that's so hard to define or explain. The best way I've kind of come up with is, you know when you leave your house and you're driving, all of a sudden you think, did I close the door? That doesn't get out of your head, does it? Until you go back and close the door. Okay? That's a compulsion to go back. The obsession is the thought, but the compulsion is to go back. And then there's consequences. There's continued use despite significant negative consequences. And remember, consequences are subjective. Somebody that's been using drugs, getting arrested is not a consequence. It's part of doing business. Some young kid who gets caught in the alley scared shitless of their parents. That's a big consequence. For others, it doesn't matter. Right? So consequences, people think, oh, well, they've been arrested 4 or 5 times. You think they learn. No. I had a client, a 14-year-old girl. She maybe weighed 90 pounds. Didn't see her for a week. Where were you? I was in the hospital. What happened? Drank a 26er. Had to pump my stomach. So pump your stomach, basically they throw charcoal into your stomach to neutralize the alcohol. Not a very pleasant experience to have that because you induce vomiting, blah, 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 blah. So you'd think that was a good learning experience. A month later, back in the same ER. Same diff. Okay? So consequences are not necessarily the end-all, be-all. The other thing is, too, is you've got to remember is that addiction is a disorder of the brain. Drugs literally change your brain. They change the way your neurotransmitters and the way that your brain functions. Okay? So, what I like to use as a general rule is, as I said this earlier, if the drug is causing health, work, relationship, legal, financial, or emotional problems, it may be time to get help. And you don't wait for all of these to get help. Okay? I know that some people, there's the AA philosophy of hitting rock bottom. That for me is the equivalent of a doctor saying, you know what, you have an infection, but let's wait until it gets really bad, then we'll deal with it. Okay? You deal with it when you can. So, by definition, if you have a problem with one of those and you care about that, maybe it's time to get help. Any questions so far? Okay, so let's talk a little bit about risk factors, and there's a lot of them, okay? As you know, in psychology and in mental...
Actually, I do have a question.
Sure,
As I remember reading something in the Globe and Mail on addiction, and they were referring to the debate of addiction being a choice versus a, just like what you were talking about,
yeah, that's in a way that's the kind of it's the AA philosophy, the Alcoholics Anonymous philosophy, that if by willpower you should be able to get over it. Current research says no. It's not a matter of having willpower. I mean, some people will say it's willpower, but some people have just, we could use resiliency too. It depends on the support. It's hard to kind of quantify why people can quit more than others. But having said that, I will talk about a little bit later on about treatment and fitting the treatment to the person, which makes it a lot easier to deal with an addiction. But yeah, there are some people, once again, the physiology, there are some people that are able to quit like that. I don't know how many smokers are in here and how many people have tried to quit. But typically, trying to quit is an ongoing process. And when it comes to addiction, there's 90% rate of relapse. And they say you've got to usually quit about 7 times before it kicks in. So yeah, there is that. The idea about willpower and things, that's more kind of a moral argument, and more of a kind of like if you're a strong person, and it's basically more or less been kind of discredited. Does that answer your question? So risk factors. Well, some personal factors. Our friend genetics. Always a genetic component to everything. Anywhere from 40 to 50% of addiction might be genetic. But the problem is that they haven't been able to isolate the actual gene that causes addiction. So, twin studies and what have you. There's biological factors, how people break down alcohol. Certain people can, certain cultures, certain races can break down alcohol or have the enzyme, or don't have the enzyme that breaks down alcohol, making it more problematic for them. Then there's the drug effects themselves. How is that affecting the physiology? There's personal characteristics, so high vulnerability to anxiety, depression, and one of the biggest let's say, red flags, we'll say, is impulsiveness in youth. The more impulsive, the higher they tend to use drugs. And when you think about it, it makes sense. Impulsiveness is doing something without thinking about it. Okay? Mental illness, comorbidity between drug use and mental illness, anywhere from 40 to 70%. And we're talking anything from the typical anxiety and depression are the big ones. But there's bipolar and schizophrenia. Gender. And it's amazing that we kind of, like I said, we kind of use addiction as a kind of one-size-fits-all. But there's differences between adolescents and adults, and there's quantitative differences between women and men in terms of addiction. Unfortunately, women tend to suffer almost twice as many consequences of addiction than men, physical and emotional. Men get addicted more, but to different drugs. Okay? Women tend to get addicted more to depressants, whereas men get addicted to more the stimulants. It's almost stereotypical, because stimulants make you feel powerful, right? Whereas the depressants kind of numb any kind of pain or anxiety. Early drug use is also a very strong indicator. The earlier you're using drugs, the more likely it is that you're going to be dealing with an addiction as you go on. And this is not just simple, like I tried a drug early. It's also, you got to think that it's also, look at your environment. If you're using drugs when you're 12, what's the home life like? What's going on in terms of any kind of control over your life? If you're using drugs at that age, typically you're hanging out with older kids that aren't going to school. So there's a lot of other factors that are involved instead of just early drug use.